Hello everyone, I am Dr. Sakamoto. Today, I will talk to you about osteoarthritis of the knee. About 30 million people nationally suffer from osteoarthritis of the knee. Let's take a look at the symptoms, typical treatments, and the regenerative medicines available. Osteoarthritis of the knee affects more women than men with a 1:4 ratio. As I mentioned earlier, 30 million Japanese suffer from osteoarthritis. Let me describe this disease and its causes. Cartilage within the joints can wear down with age or be damaged by overweight. This can result in degeneration of cartilage. In addition to these cases, the bow legs curved outwards, and heredity may affect too. Heredity can cause a person to be born with a soft cartilage or torn cartilage. Persons with soft cartilage may experience increased wearing down and accelerated deterioration. As this progresses, the joints become deformed and inflamed, which leads to pain when walking, or fluid on the knee. This can make movement difficult. This we call osteoarthritis. What are the symptoms of knee osteoarthritis? Patients usually start to feel pain when standing up and stepping down the stairs. Fluid accumulates around the knee, causing stiffness and making it impossible to sit on the knees. Many people experience such conditions like these. These patients usually seek treatment with a doctor. Among my patients who complain of these symptoms, many have swollen knees, as fluid soon accumulates again, no matter how often it's removed. Hyaluronic acid injections may last only 1 or 2 days, or hardly relieve the pain anymore. In the conventional treatment, since the injections are no longer effective, a doctor will likely suggest surgery. But many patients resist surgery and get confused about what to do. Neither an injection works, nor surgery an option for them. A new treatment has recently evolved as an alternative to the traditional therapies. This is regenerative medicine. Next, we're going to examine this regenerative medicine. Regenerative medicine includes mainly 2 types of therapy. The first is adipose-derived stem cells therapy, while the second is platelet-rich plasma therapy. These 2 therapies are said to be effective. First, ASC's therapy is currently the latest treatment. When I learned about this therapy, my standard treatment concept was overturned. I was stunned. What is this? It means extracting a tiny amount of your own cells and taking stem cells and fat. These stem cells can develop into different specialized cell types. We harvest the stem cells and culture them for about 1 month to generate more numerous stem cells. These stem cells are then injected into the knee to promote cartilage reformation and repair damaged tissue. This is so-called stem cell therapy. The other therapy, PRP, uses the platelet components from your own blood, which have an ability to heal the damaged tissue faster. The highly concentrated amounts of isolated platelets are then injected into the body, which promotes the healing process. This is what PRP is. These 2 regenerative therapies discussed today will be explained in more detail in another video. I look forward to seeing you again. Thank you for watching.